am Dr. Nirosha Ponnuraj, Specialist Pediatrician, practicing at NMC Medical Center, Rolla. I have 8 years of clinical experience in managing children with common problems like fever, respiratory infections, diarrhea, vomiting, ear infections, tonsillitis and abdomen pain. And also I have special interest in growth and development, allergy and asthma. And I have a strong academic record having secured medals in both undergraduation and post-graduation. Today we will be discussing some points about influenza in children. Influenza is a viral infection which affects the respiratory passages, mainly the lungs, and it can affect the ear, throat and nose as well. And it is caused by influenza virus. The seriousness can range from a severity which can be from a mild illness with a normal fever and running nose. Sometimes it can be very severe, requiring hospital admission, even ICU admission, and sometimes it can result in death as well. So indeed, it is a serious infection of concern which has to be diagnosed at an early stage and needs appropriate treatment at an initial stage itself. The common symptoms of influenza are fever, and usually in influenza the fever will be very high. The child will be very hot to touch, and if you measure the temperature it can go up to 40 degrees Celsius, and if you measure in Fahrenheit it can reach up to even 104 degrees Fahrenheit also. Other symptoms include running nose, cough, ear pain, sore throat and body pain can be there. There are some alarming symptoms for which you have to consult the doctor immediately. If the child is having difficulty in breathing, if the child is breathing very fast, and if the child is so dull that the child is not able to feed adequately and the urine output is so low, then you have to consult the doctor immediately. Yes, fortunately there is a medicine to treat influenza, and if started in the first 2 or 3 days, it can decrease the severity as well as reduce the symptoms associated with influenza. It can decrease the duration of illness and also will decrease the need for hospitalization. Apart from this particular drug which is needed for influenza, you should also continue other measures like giving paracetamol, giving antihistamine for the running nose, and giving adequate amount of fluids to your child to keep them hydrated. Influenza is a respiratory infection and it can spread from person to person while talking, coughing, sneezing, and it can also spread through the respiratory droplet if that person uses a hanky or touches surfaces or uses a towel which will be touched by another person in the family. So whenever the person is having influenza, it is always advisable to use proper hygiene measures like covering the mouth and nose when the person is coughing. The first and foremost thing to protect your child is to get your child vaccinated. The influenza vaccine is so safe and it can be given to any child from 6 months of age onwards. So this is a vaccine which needs to be administered every year. So every year during August, September like that, the new vaccine strain which will be available, that you have to give it to your child every year. And this is the best way to keep your child protected. And apart from it, use other hygiene measures like wearing a mask, covering your mouth and nose when coughing, and using hand hygiene measures like hand washing, using sanitizer and all. The answer is no, because when the child is sick, there are chances that the child can spread the infections to others. After the symptoms start, the child will be able to spread the infection to other children for about a week. So it is advisable not to send your child to school for at least 5 to 7 days, or after you initiate the treatment, at least the 24 hours the child is not having fever even without giving paracetamol. So without giving paracetamol, the child should be fever free for at least 24 hours. Then only you can send your child to the school. So from today's talk, the take home messages are: influenza infection can become serious also. So it is always advisable to protect your child by giving a flu vaccine, and you should know the symptoms of influenza, which include a very high fever, running nose and cough, and the child can become sick also, which you can recognize by a fast breathing, the child being so tired and not feeding well and having a decreased urine output, for which you have to consult the doctor immediately. So get vaccinated, know the symptoms, stay protected and have a healthy life. I hope I have answered many of your queries related to influenza. If you would like to know more, you can reach me. I'm Dr. Nirosha Ponnuraj, available at NMC Medical Center, Rolla, Sharjah.